where you start doesn't determine where you're ended. And so while I was in that phase, again, I was centered on I'm gonna be a doctor, I'm gonna be a doctor. But here I was in working in, traveling disbursement, doing pageants, being in these organizations, and again, explore as many interests as you can and be open to understanding that your start isn't your ending. So that was the process going on then, and something I look back on and I'm like, yeah, it definitely wasn't where I ended.
Hey friends, welcome to Public Health Careers. I'm Amari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Wanji Banda. Wanji is a program and outreach manager at Elevated Co, a healthcare manager at Hollymead Rehab, and a chapter chair with Sisters in Public Health. She is a motivated and results-oriented public health professional with a background in biomedical sciences, healthcare finance management, and nonprofit partnership development. Born and raised in Zambia, Wanji's passion stems from growing up in a healthcare system that has been unable to provide high-quality, culturally appropriate healthcare services. And now she is committed to implementing change and bridging health equity and inequality gaps. She conferred an associate's degree in biology at Alvin Community College, a bachelor's degree in biomedical sciences at Sam Houston State University, and a master of public health at Baylor University. In today's episode, you'll hear and learn more about how she navigated success in her career, switching from pre-med to public health as an immigrant to the US, an immigrant's perspective on public health and health systems, how she was able to leverage an internship with Sisters in Public Health to become a chapter chair, how education looks different in the US versus Zambia, and the perspective of individualism versus collectivism, how being a medical scribe shifted her mind on wanting to pursue public health, and much, much more. Be sure to subscribe and enjoy today's episode.
Hey, this is Wanji Banda. I am a public health professional and global health corp fellow, and you are listening to Public Health Careers.
Wanji, welcome to the show. You have a very interesting path into public health, and I'm very much looking forward to learning more about it today.
Yes, I'm so honored to be here. So thank you for having me.
The pleasure is mine. So tell us, how do you identify and a little bit about your personal background?
So my pronouns are she, her. I am Zambian, so born and raised in Zambia, which is a country in Southern Africa. And so I moved to the United States, and it's actually interesting because I left Zambia in 2010, but arrived in the US in 2011 because it was like December 31st. And so I arrived in 2011, and really all I know is Texas. So when I moved to the US, I was in Houston, Texas until 2 years ago when I relocated to Dallas for an opportunity. So that's where I am now.
What age did you move to the US and what was that transition like for you?
Oof. I was 15. Again, like it's interesting because it's like December 31st to January. So my birthday is January 6th. So I was 15 and then I arrived in the US. And it's like 5 days later, I was 16. So yes, that's what it was. But my experience, talk about cultural shock. Talk about I know you got to read an article where I talk about I ate chicken nuggets for the first time and I was like, what is this? This is not chicken. And so honestly, a lot of cultural shock, and I've learned to embrace it. I've taken the good out of the experience, but yeah, we can talk more about it.
Yeah. And I guess I'll stay on this point. So, as you're thinking about that and reflecting on your journey, I know one of the things that like I wanted to highlight, or like I would like you to highlight, is
Mhm.
what is the educational differences that you see as you came from Zambia to the US?
Yes. So the first one was, so I was a junior, which back home is like grade 11 because we go by grades. So I was a junior about to be a senior. But when I moved to the US, they almost made me a freshman. And I was like, no, 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 no. Like, that's not what it's going to be. And that was because we don't have a GPS system back home. So for Zambia, we were colonized by the British. So we have the British educational system, and then we have the Zambian council system. So an 85 there could be like an A, and you move here, and that's what, like a B minus. And so it was hard for them to figure out what my GPA was. So that was the main difference. And then the spelling. Oh my goodness. Okay. The spelling. I remember I was doing like dual credit college classes, which was different as well because when you're in school back home, you're in high school. And so we have primary school, which is grades 1 through 7. You have to take an exam. Then you have secondary school, which is grade 8 and 9, take an exam. And then now you have like still secondary school, but that's like 10 through 11. So here I am, and they're like freshman, sophomore, and I was like, I don't know, like I'm in grade 11. And I remember one of the teachers or professors saying, she has the best English, because then I had to realize there's American English and there's British English. So it was a struggle doing papers because everything, my pronunciations, my spellings were in like British English. And then the last thing was with high school, I'm used to going to class and the teachers come to the class. But you're in high school and it's like your first period, you have this class, then you have to go upstairs, then you have to go downstairs, and people are dating. And we didn't date while you were a student. Oh my goodness. Yeah, I'm like thinking about everything. So, yeah, the education system is different, completely different. Yeah.
Well, I appreciate you sharing that, and I have similar sentiments. I grew up in Trinidad and Tobago, so also under the British
Mhm.
system. So I definitely understand like the transition to trying to understand the US system as well as having to change how you write words,
Mhm.
color, for example, like taking out those U's, Um,
Yes.
but like I can only imagine like what that was like for you coming across here and that experience and like kudos to you for like getting through that and like being able to be here right now to talk about the story and the experiences. I'm looking forward to hearing your story develop and like how
Mhm.
that experience of being from Zambia like really is reflected in how you've approached your public health work.
Yes. Okay. And I just wanted to add too, because you talked about the difference in educational systems, just really quickly, because I think it's important. I also realized that, and maybe it's just like Afro Caribbean countries, we learn so much about like other countries' history. So, like, I remember learning about the Atlantic slave trade and the different continents. But when I moved here, not everybody knew about Africa and the Caribbean. So I also noticed, like, in terms of history, we learn about our country, we learn about our neighboring countries, we learn about our continent, and then we learn about everybody else. But when I moved here, people just didn't really know much about Africa or like the Caribbean. So that was something that I found to be different as well. Yeah.
Yeah, there's a very American central kind of perspective that the US takes because I even think back because I went to school in the Middle East in a country called the Sultanate of Oman, and even there I went to international school, and even there we had to learn about like I could have named all of the African countries and their capitals
Hmm.
in high school, and that's something that I say is like a far cry from everyone else in the US system.
Yes.
But that I think like to the point of having these conversations and just information just being so widely available, it is important for people
Yes.
to access that information to try to like understand that things are done differently, different places and cultures are important and just like traveling and experiencing what life and what health can look like in so many
Look
different
like.
places in the world is important as well.
I 100% agree. Yeah. It's a unique perspective.
And then pivoting the conversation a little bit, I want to
Hmm.
hear more about the Black Mothers Stories Initiative.
Oh, okay. So that is, I'm very passionate. Just to start off, I'm very passionate about maternal health. And the Black Mother Story Initiative really started out as Nishay is the CEO of Elevated Co, where I work. And she knew my passion was in maternal health. And so she gave me this platform to have this program. And what we did with Black Mother Story is create a platform for maternal health professionals to engage with the community. So to engage with Black women, whether it's mothers, children, sisters, and ask questions, but also obtain information on resources. So we wanted this initiative to raise awareness on Black maternal mortality in the US, but also identify ways to reduce the high rates of maternal mortality, because we talk about Black women dying, but there's not enough information on, okay, besides racism being a factor, what about predisposing factors to Black women that make them an increased risk for maternal mortality? Or are they certain diseases that are prevalent in Black women that also kind of like accelerate their them experiencing, maternal mortality? So that was really what we wanted the initiative to be. We launched it last year, and it was so exciting because we also employed storytelling, where we had a set group of Black mothers that wanted to share their story. And so we used that as a way to connect with different communities by using vulnerability, but also trying to dissect experiences and seeing where in the system, where is it broken in the system, as to why Black women are experiencing maternal mortality. So that's what the initiative is about. And it makes me happy, it makes me proud, especially growing up in a developing country. Once I learned about my country experiencing high maternal mortality and high cervical cancer, it's just always been kind of like a passion of mine to educate and find ways to bring healthcare providers, public health professionals, to have conversations with the community. So yeah, that's a good way. That's a way to describe a Black mother story.
And what are some of the impacts that you have seen in doing that work?
Ooh, so with the event that we had, what was interesting was one of our speakers was a pelvic floor therapist, and her mom attended the event. But she asked the question on like pelvic floor therapy, and I know this is like diving into specifics, but she asked about pelvic floor therapy and said, "Hey, at my age, can I still have pelvic floor therapy?" And so I saw within like the people who attended the events and within my own friends, it shifted their focus to, I need to advocate for my health. And so I'm seeing more of, I need to advocate for my health. I need to find a way to talk to my doctor, even if, most people just want a Black doctor, or if you don't have a doctor that's Black, how do I advocate for myself? How do I ask these questions? There's been more conversation to, I need to tell my mom, I need to tell my sister, because maternal mortality doesn't just affect the mom, it affects the family. So if I'm educated, I can educate you, and you can educate, your loved ones. And so I've been seeing that ripple of, we're talking about it, but we're also being advocates for our own health. Yeah.
And this kind of leads into the other question, because I think that brings about the idea of like collectivism, of community, of like the importance of that. So you've spoken a lot about the shift from moving from Zambia to the US, and
Mm-hmm.
how you've perceived that shift from collectivism to individualism. Is it something, and it's something I've also noticed as I've come to the US and I've lived in the US from
Right.
outside, and that like outside perspective. So how do you think we can harness some of that collectivism culture to support public health efforts here and in Zambia?
I love that question a lot, because first, nobody has ever asked me that question. But because I'm so passionate about community mobilization and cultural competency, that I believe to harness collectivism, we need to promote community engagement. Because collectivism is about togetherness. And if we can bring about this like shared responsibility in the workplace, within, first of all, in the US and just globally, whether it's in Zambia or like Trinidad and Tobago, I think having this like shared responsibility of, as a community, what do we need to work on to improve our well-being? That's one thing I think can help us harness collectivism, and even looking at maybe mutual support networks. So we can stop looking at everything as a competition. And I see that in when I worked in healthcare management, of it's more like we're competing versus working for a common goal. And so again, if we can just promote community engagement, and have healthcare providers, public health advocates, public health professionals engaging with the community, we can definitely harness collectivism that way.
Yeah, I appreciate that. And I think it is so important to have that community engagement and like get the voices of that community to really share
Yeah,
like what are the challenges and the strengths that they are seeing, and how should we come together and as we're talking like collectively make the
improve it.
plans to improve health.
Yes, I 100% agree. Yeah.
And before we get more into your collegiate journey, what does public health mean to you?
Oh, coming from someone who, the perspective of like growing up in a developing country and being pre-med and then transitioning into public health means community to me. Honestly, it's about identifying gaps in healthcare services, finding ways to disseminate healthcare information, I mean, health education, increasing accessibility. So, it means community, but again, aiming for like health equity and disease control within a community. That's what it means to me.
And now for a quick break. Are you ready for the nation's largest convening focused on global Black maternal health outcomes? Well, lucky for you, there's still time to register for the 2024 Black Maternal Health Conference, hosted virtually by the Center for Black Maternal Health and Reproductive Justice on Friday, April the 5th from 9 a.m. to 5 p.m. Eastern. Hear from some of the leading experts on Black maternal health while building a network and connecting with like-minded folks. The theme of this year's conference is centering the role of technology in addressing Black maternal health disparities. If you register, you also get free access to the virtual and in-person premiere of Black Motherhood Through the Lens of Film, an award-winning documentary centering the birthing experience of 4 Black women navigating the reproductive and maternal healthcare system from conception to postpartum. Sign up today to be enlightened, inspired, and empowered at thephmillennial.com/BHMC. That's thephmillennial.com/BHMC. Or click the link in the description. Now back to the show. Absolutely. So you came to the US from Zambia when you were 15. You spoke about the experience of coming into school and how that was a culture shock, and just living here was a culture shock. You went on to get an associate's degree in biology at Alvin Community College and then a bachelor's degree at Sam Houston State University. You also mentioned earlier that you were in, I think, a dual credit class, so maybe
Yeah,
college credit. So talk us through like that progression from college credit classes in high school through associates to the bachelor's.
absolutely. So when again I moved and it was junior year, they wanted me to be a freshman. Did some testing to see if I could, and I hate to say this, but to see if I could speak English properly, and put me in a junior class. And so at that time, again, my GPA was low. I It was just hard to like adjust to the new educational system. And so my dad and my stepmom talked to me about taking dual credit classes, which is another difference, where you're in college but you're in high school but you're taking college classes. So that was one way to raise my GPA in time for graduation. And so I took some dual credit classes at Alvin Community College. And once I graduated, actually before I even graduated, they used to have, so you know how we have exams back home where you have to pass the next grade? In the US of the time, it was called a tax exam. And I was struggling in math. Math was just never one of my strong points. And so I kept taking this like math tax exam, and you needed it to graduate. And I just kept failing. It was like, I think I started with like being 20 points short, then 10 points, then 5 points. And it was close to graduation when I finally passed. And so at that point, I think I applied to Baylor and didn't even finish the application because I was like, I'm not going to get in. And so my parents decided it was easier for me to start at a community college, finish my, prereqs at community college, which I'm glad they did that because it gave me an opportunity to get integrated into more of the educational system, but at a smaller campus. And so I did that. So thankful that I excelled, even though I struggled in chemistry. And I transferred from community college to some Houston State. And that whole experience, I think, from struggling in high school and then going to community college where I was in the honors program and then getting a scholarship to transfer to a 4-year university, um, it still motivates me to keep going. And so that's what that looked like. Not sure. Did I answer the question? I feel like I went far away, but it answers the question. Okay, yeah, because there's more to it. Yeah. And I think in both, my focus was biological sciences because my passion was I am going to be an OBGYN because I feel like almost every Afro-Caribbean or person who goes into public health starts pre-med. So I'm like, I'm going to be a doctor. And yeah, that was the focus with navigating that.
I appreciate you sharing that, and that is definitely awesome. And I think it like goes to your credit that even though you came into the US, people were asking, "Oh, do you like can you speak English?" or like just testing to see that,
Mhm.
and while also struggling with math in high school, realizing when you did get to the associate college level that you were really able to excel and like see like I don't know what it was at that point in time, but like things just kind of clicked. And for that to like be a motivating factor, I think is important for people to hear as well as I always, I'm a huge advocate of the community college route for many reasons, which I will not get into today. And I also feel like there's a huge thread in public health, people choosing to go public health and like chemistry being hard.
Yes.
Like I feel like if we survey across the population,
Yeah.
chemistry is definitely going to be an outlier on a subject that people in public health like did not do well in.
It's something about that chemistry. I can go on and on, but yeah, it was hard. Yeah, chemistry is not for everyone.
Right,
Yeah,
right.
there's a struggle. Chemistry, yeah, you can either do it or you can't. That's it.
That's real. That's real. Okay, so you go into your bachelor's degree. You're
Mhm.
wanting to become a pre-med student, wanting to become an OBGYN. While you're in your bachelor's degree, you were a student-led assistant at the Office of Travel and Displacement. Tell us about that position.
Yes, so it goes back to growing up in a system where you don't get a job until you graduate school, and you don't pay bills during that time. You're staying with your parents. And so I had to get that job because I had to pay my rent. And my rent at the time was $499, which I wish that's how it was now. But my dad and my stepmom wanted me to step into that like independence and understand how the American culture works. And so I was making 725. That was the only job I could get at the time. But I look back at it, even though it's far off from pre-med, it gave me like administrative skills. I was working with numbers, and at the time I was like, I don't do good with numbers. I struggled in high school. And so it definitely gave me great administrative skills and was a good opportunity for me to work with different ethnicities and different personalities. So yes, I was balancing the job, being a biology student, taking like 5 classes, and you know how biology is. You have a lab, you have this, you have that. And so, yeah, I then started learning time management and how to how to be an adult in the United States. Yeah.
That's real. I think biology is it often ranks in the top three like hardest degrees that you can get
Correct.
in undergrad. So there's definitely a lot of work, especially when you think about the labs and all the things. I'm also a bio major, so also
So you
completely
get it.
understand. Yes, I get it. I completely get it. So
It's
big
struggle.
makes
Yes.
a lot of sense. And shout out to you for like also being able to take on that while being an undergrad and just like realizing the reality of that while also doing all the wonderful work that you do. So you're an
Thank
undergrad, you have this position, you're coming to the end of your undergrad. What is your thought process at that point in time?
you. Honestly, if I had to take something away from that, and I hate to say this, for the students out there, focus on your studies. But in terms of being involved in organizations, it's like it doesn't really matter what status you have at the time, because when you get a job, nobody's gonna, in a sense, really care about how many organizations you are part of. But being part of all those organizations would teach you networking earlier. Um, and then the main takeaway is where you start doesn't determine where you're ending. And so while I was in that phase, again, I was centered on I'm gonna be a doctor, I'm gonna be a doctor. But here I was in working in, traveling disbursement, doing pageants, being in these organizations, and again, explore as many interests as you can and be open to understanding that your start isn't your ending. So that was the process going on then, and something I look back on and I'm like, yeah, it definitely wasn't where I ended.
I appreciate that perspective. That's important. Your start is not your ending, as
Hmm.
well as I think that the perspective on having too many organizations isn't shared enough. But to your point is no one is going to look at it after you graduate. So I think to that point of like only join organizations that are going to be helpful, beneficial to you
Yeah.
in like real tangible ways. And I feel just to add like tangible way could also be like just relaxation, but like
Yeah. Now we
but
know. Now we know.
right. Right. But yeah. Appreciate that. So like after you graduated from a bachelor's degree, you got a job as a medical scribe trainer at Houston Methodist. Tell us about getting into that position and the experience there.
Yes. So I graduated, and again, I'm like, okay, pre-med. And here I am with a biomedical sciences degree, but struggling to get a job. And in a sense, I feel like almost embarrassing because I was so proud of my accomplishment. And then it's like all of a sudden, I'm like, why is it so hard to get a job? And so I was applying to like research assistant positions at the time, and we'll talk about this more later. But it's like a life event happened, and so I'm like, oh, am I going to go to med school? Like, what do I do? And so I applied to Houston Methodist, which of course Texas has one of the largest medical centers in the world. So I was lucky enough to get an opportunity working as a medical scribe. And I really used that to see what medicine looks like. So I worked with different physicians, again, just trying to get an understanding and insight of what does medicine look like. And that changed my perspective a lot.
Tell us more. Why is that?
And it goes into, what is the process of going to Baylor University. So here I was, a medical scribe working for some of the top doctors at the time in Houston. But what I realized, so as a scribe, for anybody listening who's not familiar, medical scribe, you're the person that goes in with the physician and you're basically documenting the visit. And in certain positions, you're the one also putting in the plan, and anything that the doctors order, you're the one putting in that documentation in. And so here I was just loving medicine, but then I realized it was all about the finance aspect. It was about how much time the doctor spent with the patient versus the health education going on. And that's where my mindset started to shift because I realized my passion was to focus on a community, whereas medicine focuses on an individual. So it just made me realize that how I grew up viewing medicine on TV, in movies, wasn't the same in real life. and it wasn't fully going to fulfill my passion of advocating for a community. Yeah.
And why was that important to you?
Because coming from the background that I came from, and that collectivism, I honestly think my focus has always been on togetherness, and like, if I'm good, you're good, right? And so while you can have 30 patients and directly work with them and give them that time, I love that with community health, I can focus on so many different aspects and have a greater reach. And I think reach is what I wanted because I saw the lack of information in my community. So that's why I had to make that shift. I was like, okay, it's like a savior complex of like, I want to fix everything. Um, that's what happened.
No, makes sense, and I feel like it's important to highlight once again on the path of like in public health is like you do work because you think it's like something that you want to do, and in doing
Mhm.
that work you realize, or there's something else that is really like more attuned to like what I actually envision for the work that I want to do in my life. As well as I feel like many of us have a certain perception of what it is to be a physician. And then
Yeah.
when you actually get into the environment of being a physician, you realize that it's totally different.
It is. It is. And sorry, just to add on to that, because I love to be like transparent and just as open as I can as a leader or just as a health professional. Because I know one thing we're going to discuss was, the again, Masters of Public Health. How did I get there? So I graduated from college 2017, had this plan because we always have, like, oh yeah, I'm gonna graduate and get a job in this. And so I graduated, and 2 months later, my mom passed away. And it's part of my journey that I haven't spoken about, but I think it's powerful because during that time, what was a goal of, again, I'm going to pursue medicine, but I'm going to go to be with my mom back home and study for my MCAT so I can be a doctor. And so to have that person pass away, I was in this phase where, of course, like I was mad, I was angry, I was sad, I was confused. But what also happened is I somehow was upset at the health system back home because I feel like, and I still feel this way, that that fractured health system has impacted the community and has impacted my loved ones. And so while I'm like dealing with this grief, it's okay, why why did you want to be a physician? Why did you want to be an OBGYN? And it goes back to being a resource for the community and me wanting the savior complex of how can I fix this system. And so that's also like an important aspect where sometimes things happen in life and it kind of like redefines or like puts you on a different path. Um, and it's painful, but I think it's important to be vulnerable and say, hey, part of my passion came from pain. And really that's a huge part of my story.
I appreciate you being vulnerable. Condolences on the loss of your
Thank
mother.
you.
And I appreciate you like sharing that, as well as I'm glad that you were able to channel that energy towards the systems that you
Mhm.
see didn't do the job that they should have done, and realizing that you can find work and do work to impact and change those systems.
Thank you. Thank you so much.
Thank you for sharing. So you got your master's of public health at Baylor University. When did public health as a term come up for you? When did you know that?
Funny enough, I knew it before I applied for my MPH. So in this moment of grieving and figuring out what what's the plan, I remember going on Facebook, and there was Baylor's University MPH at Baylor. Apply for this program, and I started researching. Okay, what's public health? Mind you, this is 2018 into 2019, so the pandemic is about to happen. And I'm like, okay, I see it's all about the community, and I felt that I would still be fulfilled in public health. So yeah, for me, it came before I pursued my MPH.
Love it. Love it. And what was it, like just an ad that you saw for Baylor University?
Yeah, so it was an ad on Facebook, and it's one of those things where I'm like, who's watching? Like, who's
That's
seeing this? Like, who's doing this? And I actually, so I reached out. I spoke to admissions counselor, and they were like, yeah, this would be perfect for you, and all of that. But I had 2 weeks to apply before admissions closed for the summer. So now I'm like, okay, this is something new. I have 2 weeks. I had to get all the recommendation letters. I remember writing my personal letter, just crying, because again, I'm reflecting on, like, the health system I grew up in. And so I applied within 2 weeks. And when I got my acceptance, it was the day of my mom's memorial. So kind of like, again, like going into just, you read the article, like growing up from a Christian home. So I'm sitting there like, okay, this is confirmation of, this is it. Like, okay, this is a sign. I'm going to pursue public health and do as much as I can.
That is divine. It's divine. But shout out to Facebook ads, because I want to say very similarly. That's how I learned about like Masters of Public Health
No
programs.
way.
I want to say it was like a Facebook ad at that point in time for like either, I think it was probably George Washington University Facebook ad. And
Wait,
yeah,
that
because
is
I
cute.
was doing my MCAT at that point in time and like searching for master's programs, and it probably
Yes,
was like, oh, you're in this kind of health field, so shout out to Facebook ads.
yes, yes, Facebook. Thank you.
Right. Awesome, awesome. Okay, so you decide to pursue a master of public health.
Hmm.
You do that entire process in 2 weeks, which I could only imagine was stressful, but I'm glad that
Yes.
it paid off in the end.
Hmm.
So going into your MPH, tell us about that. Well, like where were you?
I was scared. I was so scared because of, I was looking at like previous failure from, like, again, coming to the US and adjusting and like college, and I think I failed organic chemistry. I was like, I'm not looking at my GPA. I just knew I was struggling in organic chemistry. And so I went to it with an open mind. I was afraid, but I went to it with an open mind and realized, again, um, the purpose was to gain as much knowledge as I can to help communities. And so I soaked up as much information as I could, reached out to professors. Um, and it's amazing because when I look back, that whole journey, like, it was good, but then the pandemic was happening, and then we needed an internship. So the information I learned was amazing. Balancing work, internship, life was hard.
And how did you balance it, if at all? Like what was that like for you?
It was a lot of prayers and tears. And to the students listening to this, please keep pushing because there is light at the end of the tunnel. But a big thing was having a good support system. And so I could go to, my stepmom or my aunts or my sisters and just vent about writing a 20-page paper. But having that support system and even my friends knowing they were cheering me on kept me going. So yes, if you're pursuing anything, your DRPH, anything, just make sure you have a good supportive system.
I'd second that. Then yeah, because it's not easy. And as we're talking about like the collectivism, it's just so important to have that space to share, be vulnerable, and just open up. So
A
I'm an
village.
advocate. Right,
Yes.
right. Absolutely. So while you were in your Masters of Public Health, you were an intern at Sisters in Public Health. Tell us about that experience.
Yes. So again, this is the pandemic, and Baylor University. we needed to have, I think, 180 hours to graduate. So here I am, and I'm like, I've never done an internship. I didn't know an internship back home. And so how do I even find an internship? Like, what is an internship? And so I went on Instagram. I went on Instagram and searched MPH. And the first person that came up was Angela Frazier, MPH. And she is the founder of Sisters in Public Health. And so I looked at her Instagram at the time, and of course which she still does, focuses on mental health. And so I was like, oh, okay, that's a sign, because I need to improve my mental health. And I DM'd her, slid in the DMs, and I'm like, hey, this is who I am. I am with this school. I would love to intern with you. At the time, they only had the Houston chapter, and they were about to branch off to Chicago. And so she was graceful enough to transfer it from the DMs to the email and then to Zoom. And, we talked, and what was supposed to be 180 hours, just because there was so many requirements, ended up being, I feel like I interned with them for 2 years. And that too is like a part of my story, that I'm just so grateful that during that time, during the pandemic, she was open enough to allow me to intern under Sisters in Public Health, get my experience, but also support me through that journey.
Take note, everyone. I love that. So you literally like explain the process of like Googling to find information, to then
Yes.
DM the person that you find interesting, to then from the DM and sharing like the value and what you're trying to get from it, move into email, move into Zoom, move into an internship,
Mhm.
move into, which we will get to in a while. You're the chapter chair for Sisters in
Yes.
Public Health chapter. So I think it's just so important for us, like that in itself is just so important, that people just utilize what is out there, because we never
Yeah.
know what you can get from just Googling something and being interested, and then reaching out to those people that are interesting to you too.
Interested in it.
Yeah.
Yes.
Yeah, right.
I'm agreeing with you. I think that's what collaboration is about too, and outreach. It's about reaching out, and it's like, what's the worst they can say? No, but for the most part, everybody's willing to help. So I'm glad I did that.
Yeah.
Definitely
Yeah.
glad I did that.
Absolutely. Like you're just gonna be back in the same position. So definitely that makes sense. And what kind of work did you do in that internship?
So I focused on one of the core values, which is self-care, and I built a self-care guide for the members. So I collected data, of course, try to see where everybody's at when it comes to wellness, in terms of like their spiritual, physical, social, emotional, mental. And so I did a survey with the organization, and then my deliverables were a self-care guide, affirmation cards, and it's so exciting now being a part of the organization, which we'll get to. But just seeing where I started and where I ended, and how that internship brought me such a beautiful opportunity.
Yeah, you never know where a conversation, a DM is gonna take you. So definitely like
Literally,
send those DMs, yo.
literally.
And also, while you're in your MPH program, you're assistant healthcare manager for finance at Hollymead Rehab.
Yes.
Tell us about that.
I think it's funny now, but it's such a unique part of like my career journey, because it started with, during that time while I was looking for a job. My stepmom was a nurse at a skilled nursing facility, and so she was like, "Well, why don't you just apply to be a receptionist?" And I think it comes with humility of, yes, I graduated with a about medical science degree, but I'm also working part-time. So I was working as a medical scribe and medical receptionist. And so again, this position was in Houston. So I probably was receptionist for like a month, maybe like a month and a half. And the finance manager was like, "Hey, would you like to be my assistant part-time?" So I was like, "Okay." So I'm working part-time as a medical scribe and as an assistant healthcare manager. And then it went to full-time. And then it went to a promotion of moving to Dallas to be the actual healthcare manager. So there was some growth in that. And I think I struggled when I got into my MPH because I was wondering, where do I fit in public health with this career. And so I didn't know how to market myself. And I do want to speak on this, especially for people working in healthcare administration, that public health is so broad. And when we look at the social determinants of health, literally almost every career falls under that. So what I realized was I was focusing on like the financial piece, just overseeing financial aspects of, like a healthcare organization. But I was also addressing economic stability and like the healthcare system with that. And I'll just go into detail with what the job um, entails. So, as a healthcare manager, a healthcare finance manager, what I do still, even though I'm transitioning out of that, is I work with a skilled nursing facility to ensure that they're compliant with Medicaid and Medicare policies. And so I work with patients, family members who are at skilled nursing facilities that can go home because there are times when health conditions happen. And so there are times when, say, a patient got amputated and they can't return home, but they need a long-term care facility, but their insurance won't pay for long-term care. And so that's where I step in to say, hey, do you qualify for Medicaid? Let's gather the financial documentation. I'll send the application. I think in total I have worked, including renewals, I think I've worked on like 150 Medicaid applications, just getting them approved. And then it also comes with seeing financial patient rights. And so making sure that, we're also staying in accordance with Texas Health and Human Services, their regulations for a patient being in a skilled nursing facility. But it's an interesting perspective it's given me because I think I beat myself up a lot on, am I in public health? Am I doing public health work? But I am addressing economic stability through that position. So, yes, if you're in healthcare administration, you are still addressing some type of determinant. And if you're pursuing public health, do not be discouraged.
Absolutely. It falls into the bigger bubble of public health. So
Yes.
definitely is in that way. And in you saying that, because you moved, as you said, from like healthcare manager to I think another position to then
Mhm.
the assistant healthcare manager to another position to then healthcare manager. You said that was challenging. How did you cope with like that added responsibility or the added rule and yeah.
I think I cried a couple times. Which is not, it is not, well, it's a healthy response to a certain extent. Like it's a truthful response.
Crying is a
But
strength. It's a strength.
but I was eager to learn. So it's so funny because we go back to high school where I was failing my math tests because I was not good in math. And now I'm in a position where I am dealing with finance. And I'm like, I have no finance. Like, how did I get here? And so it's just funny how life happens. But I think I was eager to learn. It was challenging because I didn't understand. I'm like, policies and Medicaid and Medicare and what are we doing and collecting or billing patients. But me being eager to learn, whether or not it led to, again, figuring out how does this fall into public health, I just wanted to learn. And now I look back, it's given me a different perspective when I'm partnering with organizations because I'm looking at, okay, well, the community we're working with, what's their financial status? What is their health insurance status? And so being eager to learn and just being open to new opportunities and soak up as much information as you get is how I dealt with it, besides the tears. But yeah.
Hey, crying is a strength. It's a strength, everyone.
Yeah.
And that's good to know. And I feel like because many times we are thrusted into like positions where we have a lot more responsibility than we're typically used to, and it is definitely a learning curve to get up to speed and feel comfortable. And I can imagine like imposter syndrome and all these different things are going
Yes.
on.
Yeah,
But
especially imposter syndrome. Sorry. Um, yeah, that's a topic and it's on like that needs a different session. But yeah, I think a lot of us struggle with imposter syndrome for sure.
and were there any takeaways that you wanted to share from your time during your Masters of Public Health program?
So main takeaways, and I think like for from my masters, but also from the job, I think the first one is networking. Um, For some reason, I started my LinkedIn page late because in undergrad, I just didn't. I'm like, what's LinkedIn? What are we doing? Even though I was so involved on campus, I didn't start my LinkedIn page until my MPH. And I think a big takeaway is utilizing that platform to network. Like, I wish I had started networking earlier, but a big takeaway is like start networking as soon as you can. Like, don't wait for your degree. Don't wait for a job title. Just start networking and start with your classmates, but your professors as well. Like, build those relationships. That was a big takeaway. And just going again into my position as a finance person, it's always network. See if you can collaborate with other people, and just be eager to learn.
I agree with that. Definitely use the tools that are available to us, as you shared, and as we'll get into right now. Is you never know where that DM will take you.
Yeah.
And so you're the Dallas Fort Worth chapter chair at Sisters in Public Health. Tell us about getting into this position and what you do.
That amazing DM. So I did my internship, and again, it was supposed to be 180 hours, but because of waiting on the school to approve the paperwork, I was still interning with Sisters in Public Health. And so when I was probably like a semester left before I graduated, I relocated to Dallas for the same healthcare manager role. And so I was wrapping up my MPH, and I had wanted to step up from intern. I just wanted to step up in leadership. And when I moved to Dallas, they had just launched the Dallas chapter. So I was sitting there like, is this a sign? Is this for me? But so much was going on at the time, balancing school, work, a new city. And so I was just waiting. I was like, I'll just wait on the opportunity. So when it opened up end of 2022 into 2023, I had a conversation with Angela and said, you know what, I'm ready. Like, let's do this, you know. And so I applied and got the position. And it's such a beautiful story. Again, just you never know where talking to someone would take you. And this is my second year as chapter chair, and I can see how I'm almost like hungry to keep growing the public health community in Dallas, because for some reason it's almost like non-existent, or you have to go and search for it. And so with the Dallas chapter, my goal is really just to keep growing, keep networking, but also see how we can collaborate with other organizations or other people to make sure that the members are growing, whether it's it's through professional development or just like self-care wellness. But I've been very intentional about how I step into leadership, and it's a beautiful experience. It really is. It's just amazing to look back and see how far I have grown with the organization.
And tell us about that intentional step into leadership.
Yes. And so transparency is important to me, and presence is important to me. And so when I moved and there was a new chapter, I just felt that I wasn't ready to give myself at the time to the chapter. I don't think when you start an organization, when you step into an organization, you need to be ready to be present, and I didn't want to just have this title but not be able to engage fully. And so that's what it was. But about intention as well, it's, hey, this is a community. Like, people will be reaching out, people will be looking up to me. And so the conversations that we have, I used to say this a lot in undergrad, of the engagement you have with somebody can either make or break the person, because you can have a great conversation and they feel empowered, or you can have a conversation that makes them feel less. And so I was intentional about, I want to step in this role because I want to grow as a leader, but I want to provide opportunities for this community to grow as well. And that was the mind process that went into it.
Beautiful, beautiful. And I agree with you. Like, if you're going to take up a position and like really try to be present in it, don't just take it to have a
Yeah.
title or to be a figurehead. So yeah, I'm glad that you are intentional in taking that approach. And yeah, that's awesome. Huge supports of Sisters in
Thank you.
Public Health, and glad that we can connect today.
Yes, I'm definitely glad.
And I guess that to that point, if someone was interested in joining a Sisters in Public Health chapter, because I can't remember how many chapters there are right now, but there are a lot of them around the country. What does that process look like for someone to join?
Yes, and so we have 23 chapters. So yes, a lot of chapters, but if you're in a city that doesn't have a chapter, we now have what's called the national chapter, so anybody can join. You can always attend any of the virtual events. When it comes to membership, the sistersinpublichealth.org website goes into detail about what the membership looks like, whether it's premium membership or lifetime membership. But really, I would say look to see if you're in one of our cities that has a chapter. Reach out to the chapter chair. And if you don't have a chapter, you're always welcome to start one. Again, just reach out to info at Sisters in Public Health, or keep joining the national chapter events, because that chapter is for the cities that don't have a chapter.
Awesome. And I'll put the link to the Sisters in Public Health website on the show notes page for anyone that is interested.
Thank you. Thank you.
Yeah. Thank you for doing and supporting that work. I think Angela does a phenomenal job leading that organization. And you are currently a program and outreach manager at Elevated Co. How do you come across this? What do you do in your position?
Yes, so let's talk about learning public health careers. I think one thing I've learned recently is, like seeing the growth of public health consulting firms. And so Elevated Co was founded by Nisha Conley. She's the CEO. But funny enough, we had a class at Baylor. So during our public health journey, or degree journey, we had a class together. And I had started my LinkedIn. I'm networking, and I started by networking with my classmates, so anybody I had a class with. And so I noticed that she had started this company prior to getting her MPH, and I reached out. At the time, she was looking for an assistant role, and so I applied. We had a conversation, and ended up actually started out as outreach and partnership development. So Elevated Co focuses on programming and social media marketing, just to, get out that health education. And so with outreach, I've done a lot of partnership development with nonprofits, designing programs, whether it's like evaluating, like getting with a nonprofit and evaluating their program, and providing either like a needs-based assessment. And so it's just amazing, again, when we talk about connections and the connections you make, because you never know where you end up. And so me reaching out to her about that position now led me to being a program and outreach manager.
And what are the types of things that you did when you just started, and what are the types of things that you do now?
So when I first started, because again, it was just focused on outreach. And so I started by like researching nonprofit organizations in the Dallas area, which was good because I didn't know what was in Dallas. And so I would reach out, and some of the focus that we've done is like in domestic violence prevention, or building a program surrounding like domestic violence, just empowering the survivors. And so I would reach out to different organizations or hospital systems, and look at one of their programs, try to partner with them. And then from there, the program manager would take on. And so again, I started with the outreach, but now I've been able to design a program, provide it to a nonprofit and say, hey, you focus on, like, I'm using domestic violence. And so we partnered, wrote a program proposal that they accepted, and focused on different programs. So one of the partnerships that we've had is with C5 Texas, where we were invited to their leadership summit. And so they focus on educating students that are in a low income kind of social demographic. And so we've gone into their leadership summit and talked to the eighth graders and ninth graders about social media and its impact on mental health, or how you can use social media to improve your mental health. And so that's part of the work that I'm doing now compared to when I first started.
And what do you enjoy most about your role?
I love outreach. I love finding out about organizations. And to me, it's the more organizations I'm familiar with, the more I can direct certain populations to that organization. Because what I've learned is there's so many resources, but people don't know about them. And so being able to just network and partner and talk to people and learn new things is something that I enjoy doing, because we're bringing access to certain services that people need.
Love it. You're also a US fellow with the Global Health Corps. Tell us about that experience.
Yes. And so the Global Health Corps is a global nonprofit organization. They are based in the US, in Zambia, Malawi, Uganda, Luanda. I hope I mentioned all the countries. If I did mention you, I'm sorry. But yes, and so they're a nonprofit, and their focus is leadership. So mobilizing leadership in health equity. Their fellowship. The funny thing, and this goes back to resilience. I first discovered the nonprofit in 2017. And at the time, I was excited because their fellowship, so they have the African fellowship and the US fellowship. And the US fellowship looks different now. So at the time, I was applying for the African fellowship because I was like, oh, I can go to Zambia and do my fellowship there, because they have, they partner with Zambia. And I did not get in. And I applied again in 2018. Again, I had no idea what public health was, but I've always been interested in global health. So when I discovered last year that they were relaunching the US fellowship, I was like, oh, I'm applying. And talk about timing, because back then I didn't know really anything about public health, versus now I have my MPH, I have some experience. And so, yeah, being a fellow with the Global Health Corps is enlightening, because it focuses on leadership. And so I've learned different things about my leadership skills, and received feedback on ways I can improve, or like ways I can just highlight parts of my leadership. And just being in that space where you're open to learning has been an amazing experience.
Appreciate you sharing that, and definitely goes to show like resilience, tenacity, not giving up, just just putting yourself out there, because as we said, like the no just puts you in the same position that you're in right now, and I guess the yes allows you to build so much capacity in leadership, and just other understanding, and I can imagine also connections. So
Yes.
that's really cool.
Yes, they have an amazing network. And I think one thing I'll say too is it's beautiful with us being um, immigrants, seeing that they have fellowships in Africa is amazing, because then it builds, it brings a platform of like collaboration, where you're in the US and you can collaborate with people in another country and kind of see the difference in health system, or bounce of ideas. So it is a great fellowship. Omari, you need to look into it. The application is open, so yes, I am selling it to you.
Awesome, awesome. Well, I definitely will look into it. If not for me, for someone else out,
Yes,
for someone
yes,
else out there, I can share it with them.
yes, definitely.
And then before we move on to the last question before the Furious Five, I just wanted to ask,
Mhm.
because you shared a lot about your journey of coming to the US and just all the different challenges, obstacles that you've overcome to get where you are right now. Like, what sorts of advice do you have maybe for someone that is immigrating from Africa or another country into the US at the age of 15? Like, what would you tell them?
Mm. Mm-mm-mm. I would tell them to, as simple as this sounds, keep going. One of the things that my mom said before she passed is the sky is not the limit. Um, and I think we're our own critics, but remember that you can push yourself to get where you want to be. There'll be challenges, but that doesn't mean you have to stop. And so if you have a goal in mind, don't focus on being different in that space. Don't focus, and these are true things in terms of if you have an accent or how you pronounce that stuff or how you spell stuff. Don't ever downplay yourself. Just keep going. That is one thing I would say to them.
Appreciate you sharing that. And those differences make you valuable in yourself and bring like just lived experience that other people just don't understand, but it is valued. So yeah, awesome.
Thank you.
Yeah. And then before moving on to the Furious Five, where can people connect with you and where would you like to see yourself in the future?
I would like to see myself partnering up with NGOs, the non-governmental organizations, because I do want to do global work. I think just coming from back home, I feel like it's important for me to give to the community I was raised from, and so that's definitely a goal of mine in the future. But I just also see myself growing in my profession in public health, partnering more with people, being at more public health events is one goal of mine this year. And again, I'm so honored to have connected with you. And so it's also part of where I see myself in the future. But people can connect with me. I just started an Instagram account. It's called Wanji Banda underscore MPH. Don't judge the 7 followers I have now, but I'll be sharing more stuff there so they can connect with me on Instagram or LinkedIn. And yeah, just support me on my journey and where I'm getting to.
Well, you'll have 8 followers after this. Well, at least 8 followers. I will follow the account
Thank you. I
after
appreciate
this.
it.
You're most welcome, and yeah, look forward to seeing the content that you post, and always happy to chat more about content. So just let me know, and we can connect on that as well.
Yes, I will take your offer.
Awesome, awesome. So everyone go across and follow Wanji Banda on Instagram and connect with her on LinkedIn. Okay. So moving on to the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Mm, I love that question. What I've shared with interns or anybody who reaches out to me on LinkedIn is identify your passion and which sector of public health fulfills that passion. Because public health is so broad. And so if you're passionate about something, more than likely there's a sector for it in public health. And so just do your research in terms of that, and then gain practical experience. And so look into internships, fellowships, networking with professionals in the field, whether it's just reaching out and saying, hey, Omari, I noticed you posted this or you have a podcast. I would like to know more about your work. That would, again, you never know where you end up. So see how much practical experience you can gain or practical like conversations and engagement you can have. The last two I would say is ask for help. And it's okay to seek mentorship. And so if you go on LinkedIn and look into public health career coaches, I know Dr. Desiree Strickland has um, a platform where she focuses on like career growth and mentorship. And so ask for help, seek mentorship, and be open to a non-linear path. That's something I had to learn of. Again, where you start is not where you're going to end. And so just be open to things changing. You might like HIV and AIDS awareness, and by the second year of your degree, you're interested in emergency preparedness, and that is okay.
That's the beauty of public health.
Yes.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Mhm. Actively listen to what the community needs. I think as professionals, we come in with the knowledge and the experience, but if you can implement a grassroots approach and actually go to the community or allow the community to take the lead, that would help you be successful in my position, and then cultivate strong communication skills, especially if you're looking at outreach or partnership development. You have to have good communication skills, stay adaptable, and understand diverse perspectives, because when you're sitting there and trying to build a program, you're looking at your perspective, but you might partner with another organization and they might have a different perspective. So stay adaptable in that way and build authentic relationships. Any partnership you make, just make sure it's authentic, um, and that again, it's not just for the title. You know, you're actually doing it to help the community.
Number three, what's something you're working on improving in your life right now?
Ooh, so Teresa Alphonse connected us. She is my executive coach in the Global Health Corp Fellowship. And one thing that she's opened my eyes to is giving myself grace. During one of our sessions, she asked me, "How do you show yourself grace?" And I could not answer. And I think as public health professionals, we're caregivers and we don't really care for ourselves much. And so I'm learning to give myself grace. And professionally, one thing I'm excited for is to build a platform for immigrants and migrants to where they can obtain like health education or financial wellness and just focus on women's health. And so building my professional brand, it's in the making, but it's coming together slowly but surely.
Love it. And I think that that's a great question that we all can like reflect on, like how do we give ourselves grace, because
Yeah.
it's we aren't asked that enough, and I think it really makes us think about what we need to do to take care of ourselves and give like
Mhm.
understand that like not everything is in our control, and that's fine.
Right, right.
Number four, professionally, do you recommend anything?
I recommend the Public Health Millennial podcast, the Public Health Careers podcast, to correct myself. Because I know I followed it on LinkedIn. I think we hadn't connected, but I followed the Public Health Millennial on LinkedIn. And honestly, the platform that you have and the knowledge, the rich knowledge you have on this podcast is amazing. And so I definitely recommend your podcast. I also recommend, not sure if you're familiar with Christine Ivory. She goes by Public Health One. John, bear with me, y'all. I have an accent. But Public Health One podcast. And it goes by Public Health Gems. She focuses on maternal health, but her podcasts are very diverse, and it has great information as well. Look into the Global Health Fellowship. When it comes to books, I made sure I made a list because I love how you share books on LinkedIn. And so I think the first one that I would recommend, which probably everybody has read, is Mountains Beyond Mountains by Dr. Paul Farmer. We read it in school, and it's honestly just an amazing book because it focuses on his philosophy of the only real nation is humanity. And it's great to see, as such a humble public health professional as he was, just how he was so selfless. And then The Immortal Life of Henrietta Lacks. Have you read that book?
Yes, I have.
Ah, I read it in an organic chemistry class. It was for an assignment. Don't even ask how it ended up in chemistry, but it is a great book to dissect ethics and medical research and just how, even though a lot of things are controversial, how her cells have impacted lives. Another one is Fresh Fruit, Broken Bodies by Dr. Seth Holmes. He's a physician and anthropologist, and in that book, he actually focuses on undocumented migrant farm workers in the United States. And so he follows a group in Mexico and it kind of just sees like what they go through and how, like the US immigration policy has affected them. And one that I'm wanting to read, one that I'm wanting to read, which was your recommendation on LinkedIn, is Medical Apartheid. Yes, I'm nervous to read it, but yeah, it's been on my list.
Yeah, those are all great recommendations. I have not heard of all of them, but yeah, Medical Apartheid is definitely highly recommended. I think definitely, as I said on LinkedIn, like take your time, maybe read something else that's also light, or give yourself grace in reading it because there's a lot of heavy content throughout it that I think we as public health professionals, especially as Black public health professionals, like need to understand the impact of like what that can do on us and just being intentional in that as well. But yeah, definitely. Thank you for sharing all those books. And yeah, I'm actually trying to get Christy onto the podcast. So like Christy, if you listen to this,
she's amazing. I'm excited. I'm excited to listen to that podcast session.
Awesome. And then last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I had to write it out because it's so deep. And I had to do reflection, especially in this season I'm in. And so what the piece of advice I would give to my younger self is to embrace resilience. Believe that you belong at the table. You have a powerful story that will positively impact lives and rebuild communities. So, yeah, I'm writing that on my mirror.
Yeah, that's poetic.
So yes,
I hope I also see that on the Instagram.
You know what? Thank you for saying that. Yes. Yeah. So that's my first content creator advice. Yes. It will be on my Instagram. It would definitely be on my Instagram. Thank you.
Yeah, I'm here. I'll be here all week. But thank you so much, Wanji, for coming on today and sharing your story. I enjoyed talking with you, laughing with you, learning with you. Definitely appreciate the work that you're doing, and I look forward to seeing where your career takes you.
Yes, thank you for having me, and please continue your work. I truly appreciate it. I say it for everybody who's heard or hasn't heard, about the work that you're doing. Just thank you for all you're doing and keep going. Yeah.
Thank you. I really greatly appreciate that. Housekeeping items, everyone. Thank you all so much to listening to this or watching this. Be sure to subscribe if you have not as yet. I feel like if you got to the end, you should be subscribed. Leave a like, leave a review, and share it with a friend. Greatly appreciate you all. See you all next week. Peace.
Bye.